Namaskar everyone and good morning to all of you. Here I am Dr. Manish Yadav. Again, we are here come together to learn about Burnett series in the continuation learning of series of Burnettes. Especially what we are doing is what I am trying to do is to share with you my learning and my teaching through Burnett, his approaches, his way of practice. And also, I hope before watching this video, you must have gone and heard my initial videos where I have given a background of it. Now, in this lecture, what I'm going to talk about, I'm going to pick up a case, especially a case of uterine tumor, and we'll go deeper into it and see how Burnett used to practice and what was his thinking. A few things I might not be repeating it again because I have already spoken about these, his philosophies and answers in my earlier videos. So I would request you that you can go. It would be better before you see this video if you can watch out my old videos, basically to get an idea about it, the philosophy and the thinking process of Burnett behind his prescription. So let's directly jump to a case, and I'm going to show you a case and share you a case which you can find in Tumors of Burnett book. Let me share this PPT. Okay. It's the chapter number 13. If you go in chapter number 13, we have got a case where he talks about a case of tumor of uterine region. Now, uterine tumors, we have so many females come up with so many uterine problems. It's not just uterine problem, fallopian tube, ovaries, the entire pelvic area is being affected. Homeopathy, I feel, has a great scope in managing these kinds of cases. Homeopathy, in my terms, I have got a lot of female patients where after treating them, I realized that homeopathy has got so much scope that so many illnesses that these females suffer, the hormonal disbalances that they suffer, we can really help them to a great extent if properly we understand the philosophy, the medicines, and how the body is functioning. So let us go ahead and talk about this case. And few excerpts, I will share the case and its prescriptions, and of course try to fragment it and try to learn from it why he gave the remedy, what was his thinking process, so that we can get some learning into our cases when we start our practice. August 3rd, 1885, an unmarried woman, 37 years of age, came to me on complaining of a swelling in the lower part of her abdomen, which had been there for some years. It appeared to me to be seated in the broad ligament of left side near the uterus. It was hard and about the size of baby's head. She complained of dreadful pains in the uterus and its region. So from here, what we get an idea? We get an idea of the location, we get the idea of the organ affected, and then we get an idea of a symptom. There is a symptom, individualizing symptom. There is some pains and aches. Now, next thing what we need to know is about the modalities. So let's see what he observes here. I just love this. I just love this. I have said in many of my lectures that whatever patient comes with, patient will always come with their pains and aches and discomforts. The present predominant symptoms, they are mostly focusing on that. That is definitely important because we need to get to the modalities, we need to get to the other aspects of it, the locations, the sensations and everything. We need to understand that. But I'll tell you, my friends, in my clinical experience and my experience till now, what I've learned from my teachers and I'm being using in my practice with such a great result is try to elicit and form and understand the origin of the disease. How did it start? How did it start? Of course, we're going to talk about miasms in some videos. I will be talking about miasms and try to expand this idea. But to give you just hint that none of the disease just comes like this. None of the disease just comes like this. Of course, we have got signs, symptoms, and accidents. There could be an accident, but even accident, like just imagine somebody falls down and he gets a fracture, that's okay. But he gets a cancer or a tumor, that should not happen, right? So there could be an exciting cause. But what is the disposition? Both things has to be taken into consideration. So it is very important, either in acute or in chronic. Fifth aphorism of Organon: acute disease look for exciting cause, and chronic disease look for fundamental cause. That's what Hahnemann speaks about. So let us see. He also asks, and you will see in Burnett cases that in many cases, he always goes back in the past history and the family history or the diseases. How did it start? Where did it start? He tries to trace the origin of the disease going into the past, which is very crucial. So patient says 7 months before, she had a fall from a chair, from which time the pain had been very severe. So now here we get a clear-cut exciting cause. She had an injury, she had a fall, and she got some pain there. And then, of course, tumor came up. So, of course, you know that now, till now, of course, you must be knowing the remedy, which was the favorite remedy of Burnett, where injury happens and deeper tissues are involved, cancer or tumor or such things, come in. Belisper is the remedy. Belisper is the remedy. So, when I was reading it, I thought, maybe Belisper has to be given. If it was my patient, I would have just started with Belisper. Let's see what he says. Few more symptoms. For past 2 years, sensation of pains and needles in hands and arms. Now, this is very important here. So, Belisper will be required because it's an exciting cause needed, maybe. But here, Belisper or any injury remedy that you're thinking of is an exciting cause. Here, injury is an exciting cause. It is not the fundamental cause. Because 7 months before she had fallen. But for past 2 years, she's having sensation of pains and needles in hands and arms. So there is something beyond the injury also. Before she got a fall, there was more discomfort, and there's another layer in the past. And you see here, the remedy, modality that he gets is awakening in the night and towards morning. So all the discomforts that was there was awakening in the night and towards morning. The prescriptions of Burnett are really simple. So now what he gives here, I will tell you the remedy and then I will tell you the analysis. He starts with medorinum. Now people will say, why medorinum? Why medorinum? The number one thing is fundamental cause. The injury which happened is an exciting cause. It happened just 7 months before. But since past 2 years, she's having pains and the needles in hands and the arms. The tumor is there. It got excited after the injury, but it was still growing. So uterus is affected. Pains and the needle pain is there. Neurological symptoms are there. And modality. Awakening in the night or especially towards the morning. So daytime to sunset is psychotic origin. So psychotic remedies, and especially it's a keynote of medorinum. And if it is sunset to sunrise, like in the night, it is an indication of syphilitic remedies and especially syphilinum. So even giving a nosode, why nosode? Why psychosis? Because Hahnemann's miasm, when you try to understand, very clearly Hahnemann has said the psychotic, anything with genitourinary organ affections, pelvic affections, you should first think of psychosis. Psychosis is in the background. Please go and open medorinum, Allen's keynote. You'll get an answer why medorinum. I'm just telling you exactly the paragraph. Medorinum, third paragraph, where he talks about all the features of ovaritis, salpingitis, and all other aspects of pelvic organs being affected. I will read exactly. So you can read the third paragraph from Allen's keynote. For women with chronic ovaritis, salpingitis, pelvic cellulitis, fibroid cysts, other morbid growths of uterus and ovaries, especially if symptoms point to malignancy with or without psychotic origin. So he says that females who have affections of uterus, pelvic origin, medorinum, and you're thinking of psychosis in the background, medorinum is most closer and most similar remedy, most similar psychotic remedy that you should start with. I can remember one case. I have used this in a lot of time as an intercurrent in my female patients who come with fibroid fibroid, tumor, or menses irregularities. It has helped immensely. I had one patient where she was having fibroid, uterine fibroid, and she used to get bleeding and the pains and all those things. She was quite stable for a long time, but in between, the remedies which I was giving stopped working, and suddenly she started a lot of pain in the pelvic region, severe pain. I was taking the modalities, I was giving remedies, but failing. Bleeding was also there, and nothing I could think of a remedy which was very close to it. And suddenly, looking into the past, I realized this could be the affection is only in the pelvic region. There's a tumor, malignant. She's a patient of like malignancy, adrenal tumor she has. Psychotic origin was too much, and pelvic area was affected. And I remembered this Allen's keynote, third paragraph. On that basis, I gave Medorrhinum. I gave Medorrhinum 1M, and it was a beautiful recovery, beautiful. The entire pain and the bleeding slowly, within 3-4 days, it subsided, the clot subsided, and she was much better after that. So knowing the zoic remedies, zoic is the, I call the zoic remedies, means the miasmatic remedy. It is not just going into the past history and, just giving the remedy. It is also important that we should learn our materia medica, because all the remedies that are given, maybe you give on 2 symptoms, 3 symptoms, that's okay, but it has to be given on a characteristic, keynote, and individualizing symptom. More you can individualize even the zoic remedies or psychotic remedies, like you have to give thuja, you'll see something of thuja, left-sided affection, perspiration, localized part, few other aspects of it, right? Unusual hairy growth. You talk about syphilinum, you talk about tuberculinum, you talk about carcinoma, thyroidinum. We should read these remedies from different books so that our knowledge of these drugs, our materia medica has to increase. That's why all these people, all our pioneers, I feel they were masters of materia medica. I'm here analyzing Burnett cases, but I'm telling you, I'm not the right person to do justice for him. Whatever little knowledge I have, I'm just sharing it. He was master. All these people are master. They could look at the patient and give. It's not just looking at the patient and giving. They were knowing the entire materia medica. So more and more, you read materia medica. More and more, you get into materia medica. Repertory is very good, but we are too much inclined to repertory and forming the totalities. We are so busy in learning the meanings of rubrics, which is okay. But I'll tell you in my experience, the real clinicians and real results are going to come when you master your materia medica. You have to barge in. You have to spend time with Kent, Tyler, Clark. You have to go and read the Boric and Allen's every single day. That's why that's how you increase your knowledge, and that's how you can spot the remedies in your clinical practice. So let's go ahead. He starts with Medorrhinum. Feels much better. Sensation of formication is less. Tumor is clearly of mural fibroid. Less pain in the uterus. So patient feels better. Very good. Again, repeats Meadow. The formication has entirely gone. Now, this is amazing, right? The formication has entirely gone, and she declares herself wonderful and better. Now, formication were there in the hands, right? I think, yeah. The formications were there. Let us check. Yeah, hands in the palms. Many times what happens is that the formications are there. Like in this case, we would have taken the formication, we would have repertorized it, we could have tried to find out a remedy for formication in hands or tingling and numbness in hands. Many times, it is a referred symptom. When the organ is affected, like in this case, uterus is affected. You gave a remedy for uterus, the main sphere of action, the main organ which is affected. You treated that, the referred symptom was on the formication, it went up. It happens in liver cases. Many times you're treating, patient comes with flatulence, acidity. We are giving nux vomica, robinia, phosphorus, natrum phos. We are treating the symptom, but we're not trying to understand sometimes that liver can be a damage. So you treat the liver, the cause, you with your organ remedy or any other remedies as such, you address that. You'll feel that you'll see that the referred complaint, the symptoms for which the patient has come, it abolishes, it goes up. So this was a very good learning for me, and that's what it says, that we have to look for the organs which are affected, the organ which are connected and disturbed. Now here, the formication and the uterus is better. So what he says is that he gives Belisper. Of course, why Belisper? I told you that 7 months before there was an injury. Now here you can debate that why a patient is better than why to give it. But according to Burnett, and as I understood that Burnett was a person who always used to find out the cause, and he has had an idea that I have to remove or neutralize all the causes that is there for producing disease. So injury has a very important role to play in tumors, especially in formation of tumor, which Burnett has seen in his cases. Of course, Belisper, Conayam, and few other remedy, Calculaflor, these are of great help. And Belisper, you can see many places where he has used Belisper with very significant results. So he gives Belisper because that was one of the exciting cause to remove that layer. Of course, the injury one. Now, tumor is trifle smaller, little smaller, gets a pain in it after she has been in the bed for a few minutes. Now, can you see what is happening here? Tumor is smaller in size, little bit. Pain is there. Pain has started. Pain is there. But pain has changed its modality. Earlier, it was in the early morning when sunrise. Now, patient is getting pain at the time of bed, night. So, night aggravation. Now, you can see how the state is changing. From morning aggravation, it went to night aggravation. So, now you can't give medurinum. State changes, the remedy has to change. So, night aggravation, he gives syphilinum. As I told you before, again, a zoic remedy. Syphilitic remedies are especially in the night aggravation is too much. And as I told you before, psychotic ones, mostly in the morning times. So state changes, remedy changes. Of course, the zoic and the miasmatic remedy. Pain has gone. Now this is so interesting. I hope you might have also seen that in many of their patients also these things happen. Okay. I just need to get this out. Okay. The pain is gone, but the pains and the needles have come up again. And when it is there, it is on awakening. And he starts with medurinum again. Tumor is smaller. Why medurinum? Why? Because now you see another follow-up. The pains have gone. But now again the symptom changes to awakening. When he's awakening, the pains and the needles are there. So night aggravation turns into morning. As the state changes, he changes the remedy. Pins and needles gone. Hands are still numb. No pain. Uterus feels now through the abdominal peritus like one about 3 months cravate. There is not and never has been any leukorrhea. So patient had never had a leukorrhea. Now this is also very strange. Why? There's a wonderful book written by Burnett himself. I have it on my desk. I can maybe show you if you can see from here. Okay. You can't see here. I can read the name. The Change of Life in Women from Burnett. It's a very small book. You should please read that book and how beautifully Burnett has explained about the process of female organs, their bleeding and the discharges, how it is healthier and why it is needed, why women are stronger than men. A lot of beautiful nuggets are there. Leukorrhea. We treat always leukorrhea, right? We treat discharges. But you have to understand that leukorrhea is actually a discharge. Any discharge which is happening from any place is therapeutic in nature mostly. Naturally, it is a therapeutic in nature. All leukorrheas not need to be treated. Of course, if it troubles, you have to treat. But not all leukorrheas have to be treated because that's the way toxins are thrown out of the body. And the females, like in this case, she never had leukorrhea. What does that mean? The body was not able to throw out toxins. So with your medication, if the leukorrhea starts, I think that would be the best thing. And that's how you know that you are on the right track. If it starts, let's see. Now here, what he does is that he gives LAPIS ALBA. somato, syphilinum, accident, everything he has managed. Now what has happened is that there are no symptoms as per, there are no modalities, there are nothing else, no discomfort, no formication, no physical complaints are there. Only organ is remaining. Means only tumor is remaining. So here comes the role of organopathic remedy. I have talked about organopathy. Organopathic remedies are those remedies which are specifically focusing on the organ itself. So when other symptoms are not there and only organ remains, like here, only tumor is remaining, which is, 3 months old, gravid, whatever he's saying, is only tumor is remaining. Fibroid, soft tumor is remaining. With other remedies also, you can differentiate, and he starts with LAPIS ALBA as a, as an organ remedy. Better all around, menses normal, tumor undoubtedly smaller. So the role of organopathy comes into picture. So you can see very nicely that, people, I've heard that Burnett was specific prescriber, always changing the remedy. I feel there is a lot of science behind his thinking process of changing the remedies. From this case itself, you can understand how beautifully he was looking at the fundamental causes, and whenever the symptoms were erupting, he was treating it with those specific anti-miasmatic remedy, individualizing those anti-miasmatic remedies and giving it. Number one. Second, he was also looking at the exciting causes. Third, he was looking at the symptoms like formication or other discomfort which comes. Like in other cases, you'll find out another physical complaint which comes, you will address it with smaller remedies. And ultimately, when all the symptoms have abolished, an organ is only affected, he will think of organ remedies. Wonderful. It is wonderful. He repeats again because it is in low frequency. Keeps repeating. Getting well, very well. She says, no, the uterus can be ballooned about just under the umbilicus, still tumid. Repeats. Better, no pain, no numbness, no pain, very much smaller. Now there is some leukorrhea. Wow. As I told you before, if your medicine can help this patient cause leukorrhea, means you are on the right track. So now, no other physical symptoms. Organ remedy is helping. Tumor is going down slowly, and leukorrhea started. Don't try to treat leukorrhea in this case. Sometimes we do mistake, like, patients come, patients don't know homeopathy, right? They don't know the law of life. They will come and say, this is happening, that is happening. You don't have to start treating everything what patients say. We have to have a sense of law of cure. What is law of cure? How the body reacts. And especially anything that comes on skin, anything that is exteriorizing, please hold yourself. Impulse to prescribe, please hold. However, individualizing symptom comes. Yes, if it persists and it creates trouble, then of course it has to be addressed, but later on, not to be panicking in the hurry. We can make a lot of mistakes. Better, no leukorrhea. Now you see, leukorrhea is gone. The body is throwing out toxins. When it is over, it is gone. No pain, no formication. She feels well. No tumor can be found. The womb is no longer able to be felt or found through the abdomen parenthesis. I'm getting well, getting on very well. Thank God. The tumor has left no trace of itself. Everything is normal. And she got completely cured. 6th September, well, along. Thereafter, her mistress informed me the patient continued well and oddly enough also grateful. LAPIS ALBA, let's read LAPIS ALBA. Now, what I do is that how I use Burnett, because see, Burnett has given cases and remedies. Of course, he has given his philosophies, but he has not explained the remedies in terms. He has not given a repertory chart, or he has not given the indications of it, which I feel he has done it deliberately because he really wanted us to go and read the remedies and understanding and develop our own thinking process. So what I do is that whenever I see a new remedy, whenever I see some symptom, I try to analyze it. I try to go and read in the mathematics and find it, why he gave it. All those things which I shared with you, it's not given in Burnett use, right? I have tried, after reading so much Burnett, I have understood that these are the indications. So LAPIS ALBA came into picture. I said, let us read LAPIS ALBA because yes, he gave for uterine tumor. Now, I can't get all the patients of uterine tumor, I can't give LAPIS ALBA. When does LAPIS ALBA should be used? What is its pathology and what is the mathematics of it? That has to be learned. So maybe a few minutes, we'll just scroll. LAPIS ALBA, first of all, understand that it is silicofluoride of calcium. Silico. So it has got calcium, fluoride, and silica. All the three components are combined. Affections of glands. Mostly glands are affected. Goiter, pre-ulcerative stage of carcinoma. There's a lot of burning. You can see in breast, stomach, and uterus. Connective tissue about the glands. Again, the gland comes in picture. Fat, anemic babies with iodine appetite. Okay. Ravenous appetite. This is very important symptom. So you can see the trace of iodine. You can see a picture of iodine also. Iodine appetite, like, feeling very hungry. So ravenous appetite like iodine. Remarkably successful in scrofulous affection, except for malaria cases. Means he's saying that it's a very good remedy for uterine affections or any glandular affection, and very specific in a way for uterine cancer. Fibroid tumors with intense burning pains. Okay, let me give you one understanding which I understood about organopathic remedies. Many times people feel that organopathic remedies are such that you know this remedy for this organ, you give it. Okay, that is okay at a very superficial level. But my dear friends, what I have understood from my cases and my seniors' cases and successful cases, whatever I have learned, I've realized that even the mother tinctures or the expotency remedies or specific organ remedies that you give, it's not going to work until and unless it is individualized. You have to find out the individualizing symptom. There is no specific remedy, though we say organ remedy are specific to organ, but it is not just only sphere of action is matching. There are 10 remedies more with sphere of action matching. So you have to find out, especially what is written in Boric, especially, or Clark, Allen's, wherever, but especially Boric, the bolds and the italics, those have to match. Like here it says fibroid tumors with means concomitant symptom is what? Intense burning. It is given in bold. It's very important. A lady comes with fibroid tumor with intense burning. As we read earlier in general, burning, you find burning everywhere, breast, stomach, uterus. Like, triads of burning we have, phosphorus, sulfur, arsenic. It has got fibroid tumor with burning pains through part with profuse hemorrhage. So profuse hemorrhage, internal burning like phosphorus, and then tumor. This is how I remember. So, when burning is there, a lot of burning, and uterine hemorrhage is happening, I will always think of phosphorus, one of the remedy, if it is active burning. But if it is fibroid tumor, then maybe think of, and glands are affected, LAPIS ALBA comes very close to that. Glands have certain elasticity and playability about them rather than stony hardness. This is the another important characteristic symptom. Like cystis and calcarea floor, the floor element always provides the toughness. So this is also calcarea floor, okay, but it is silicofluoride of calcium, means silica is also there. Because of this combination, what happens generally is there is softness. The tumor is not hard, like cystis and calcarea floor, that it is stony hard. So stony hardness is contraindication of LAPIS ALBA. So wherever tumors are there, glands are there, which are soft, you can touch it, you can palpate it, and it is soft, spongy. Elasticity is there. There you can think of LAPIS ALBA. Scrofulous, goiter, and carcinoma. These three things you should remember. Scrofulous, goiter, and carcinoma. Clark says affection of glands and lymphatics. It's also a very important remedy for lymphatics and lymphatic glands which get obstructed, and you get nodule formations in the lymphatics spread. Enlarged gland where there is degree of elasticity rather than stony hardness. Remember this part, very important. That elasticity has to be there. Stony hardness, contraindicated. LAPIS ALBA is not there. Scrofulous affection, abscess and sores, enlargement and induration of glands, especially It could be cervical, glandular tumors where no glands are usually found. See this, glandular tumors where no glands are usually found. If there are certain areas where glands are not there, but then there is a tumor there formation. You can think of LAPIS alba, goiter, cretinism, lipomas. If you have seen patients of lipoma, and LAPIS alba is basically, I don't treat lipomas. Generally, I send patient back, explaining them it is not hazardous. But sometimes, patient eat your head. I have given LAPIS alba to many of them. Few of them have got benefited. I don't know much about it, but I really don't treat. But LAPIS alba, I use it a lot in lipoma cases. If patients, trouble you and they want, please give something, I give LAPIS alba. If you touch LAPIS alba, if you touch lipoma, very soft it is. That is the consistency and the character of LAPIS alba in glands. So lipoma, sarcoma, glandular and fibrous tumors, carcinoma, as long as ulceration has not set in, based on scrophulous, means glands, soft elasticity. Ulcer forms, the sphere of action ends. Other remedy might be indicated. Serous means tumor, tuberculous scrofula, so tubercular origin. As I said before, that organ remedy should not be think just as a specific organ remedy, but the individualizing symptoms has to be understood. So when you think of LAPIS alba, of course, elasticity is there, tumor is there. That is the character of the glands and the swelling. But along with that, you find burning, you find bleeding. And also, I told you that it is like iodine, right? Very much hungry, ravenous hunger. So that is one part. Burning is there, like, internal burning, like arsenic, phosphorus, sulfur. A lot of burning is there. And another keynote symptom is fainting. Swoon, it is said, fainting. Let us see that. What is it? When you read in Clark, he says, of course, in stomach, he talks about, again, ravenous appetite caused in case of cervical glands. Okay. So I just remembered, I had cured one case of goiter where I gave iodine. At that time, I was thinking of LAPIS alba in that case very strongly, because this symptom I was knowing that cervical glands affected or some goiter is there. Along with that, ravenous appetite. But of course, she had other features of iodine, so I prescribed iodine. But it is very close. Just to give you a hint, whenever thinking of iodine in these terms, LAPIS alba is very close to that. Female organs, let's come to that. The symptom of fainting. Painful menses suddenly taken with pain so severe that she swoons. Swoons means fainting. Faints with pain at menses. Now, so many patients, we get female patients who have dysmenorrhea. Painful menses. They will, take holiday, they will sit, they will take rest. There is so much pain, they will take medication. But it is very rare to find patients where pain comes and they faint. This is the characteristic symptom of LAPIS alba. So it's a very painful remedy, though, dysmenorrhea. So you can keep in mind fibroid, dysmenorrhea, burning, ravenous appetite, and fainting. If accompanied, maybe LAPIS alba can be of great help to these patients. Ravenous hunger and elasticity we already spoke about. When you read Clark has given very nice description of LAPIS alba. I would urge you to go and read. He says that leading indication is burning, shooting, stinging pain in cardia, that is here in the pylorus, in breast and tumor, uterus, which already spoke about. It has shown great power over new growths of any kind. In 2 cases of cervical gland cured by left, DU relates that ravenous appetite developed while the remedy was being taken. So this ravenous appetite, in 2 cases cured by DU, swelling of glands, was elastic rather than stony hardness. So DU was a physician who treated 2 cases where he found out, like in 4 cases he treated, 2 cases he found out that after giving the remedy, ravenous appetite developed. Now please understand, LAPIS alba is not a well-proved remedy. So when symptoms develop, like a drug proving happens on the patients, the clinical symptoms, I feel is even more important than the proving symptom. And it can be verified clinically in different areas, and physicians can verify. So this is the clinical indication, which I was talking about, the ravenous appetite. Second part is DU cured whichever tumor he cured, glands, swelling of the glands. He found that all those tumors were elastic rather than hardy, like stony hardness was not there. So I'm done with it, guys. I hope you enjoyed listening to me. And if you have any question, you can write down in the comment box. But I would urge that please go and watch the videos, earlier videos which I have made. This is my humble effort to just try and bring Burnett's philosophy and his thinking on the podium so that it can be seen by a lot of people and you get interested to go and read. Listening to my videos might inspire you, might create a lot of questions in you, which is my purpose actually. I want people to become thinkers actually, and ultimately go and read Burnett. Burnett Tumors, please pick up the book, start with that book, slowly and steadily, you will understand. And not removing, like, not distinguishing it or separating it from our classical way of prescribing. It is both. If you combine it wherever it is needed, it will make, if you take one more, it's like taking one more armory in your backyard, it's a weapon like that you have. So it can help you become a better physician so that we can help much more patients, suffering individuals in our practice. So I'm done with it. Namaste and thank you very much.